Okay, now that we've completed the knee joint, we're going to move up to the muscles of the thigh region. Now in the thigh we have muscles that act on the knee joint, some that act on the hip, and some that act on both. As with any other segment of the body, the thigh is divided up into compartments, and each compartment contains its own functional group. This is a cross section. This diagram represents a cross section of the thigh, and this green line here represents the deep fascia. So coming all the way around here, we've got the deep fascia of the thigh coming down like a stocking from hip down to foot. Periodically, the deep fascia, as we can see here, will send sheets of fascia in towards the femur. These are known as the intermuscular septa, and the function of the intermuscular septa are to separate out the three functional groups of the thigh. So here we have the anterior compartment. This is the anterior portion of the thigh, which contains the quadriceps. Over here we have the medial compartment, which contains the adductors, and over here we have the hamstring group, the posterior compartment. So starting with the anterior compartment, this is formed by the quadriceps group and this long slip of a muscle here, sartorius. The quadriceps femoris group is actually made up of four muscles. It's not a single muscle, although it's often described as a single muscle. It's made up of four muscles. We've got rectus femoris here, the most superficial and most anterior of the quadriceps. It's the only muscle that crosses both hip and knee. The other three muscles include the vastus lateralis there, vastus medialis, and then deep to rectus femoris we have vastus intermedius. These are all single joint muscles, and all four muscles are often considered together because they converge and they attach onto the tibial tuberosity via this structure here, the patellar tendon. The patella itself is a sesamoid bone that sits inside the tendon of the quadriceps, and it's an important structure. The function of the patella is to increase the leverage of the quadriceps. It acts as a pulley, so the quadriceps tendon come around the patella and it changes the angle of insertion of the quadriceps tendon, making the quadriceps significantly stronger. Historically, patients who had severely fractured their patellas surgically occasionally had their patellas removed, and one of the problems that the rehabilitation specialist had was trying to regain enough strength in the quadriceps to allow them to return to a level of functional activity. So starting with the first muscle, this is rectus femoris. I say it's the most superficial of the quadriceps. It arises proximally from two heads. It's a bipennate muscle that has a two-headed attachment. This top head here is known as the straight head, and it arises directly from the anterior inferior iliac spine, and the reflected head here lies deep to it and attaches onto a groove sitting just above the acetabulum and from the anterior surface of the hip joint capsule. It runs down and blends into the quadriceps tendon, forming the superficial part of this structure. It's the only portion of the quadriceps that crosses the hip and knee, and functionally this is important because rectus femoris will dominate when the hip is being forcibly flexed and the knee is being extended, for example in kicking a ball. Vastus lateralis is the most lateral of the quadriceps. Its proximal attachment is this blue line that you can see here. Anteriorly, it arises from the upper half of the intertrochanteric line on its anterior surface, the anterior and lower borders of the greater trochanter, before spiraling around the back to attach onto the lateral lip of the gluteal tuberosity and the upper half of the linea aspera. It also takes some fibres from the anterior surface of the lateral intermuscular septum. As it runs down, fibres come obliquely downwards and medially, and vastus lateralis goes on to form the lateral part of the patellar tendon. Vastus medialis, on the other hand, is found on the medial side. Its proximal attachment is much lower than that of lateralis, which gives the quadriceps a degree of asymmetry to their appearance. It comes from the upper 2/3 of the medial supracondylar ridge down here. Posteriorly, it goes onto the medial lip of the linea aspera. It comes up here and attaches onto the spiral line on the posterior aspect of the upper part of the femur before coming round to attach onto the lower half of the intertrochanteric line. It also takes fibres from the anterior surface of the medial intermuscular septum. Between vastus lateralis and vastus intermedius and vastus medialis, we have vastus intermedius. It's the deepest of the four quadriceps, and this arises this time from this pink area on this diagram. So it arises from the anterior aspect and lateral aspect of the upper 2/3 of the shaft of the femur. Its fibres run straight down before inserting onto the base of the patella. Now, deep to vastus intermedius, there are a few fibres of vastus intermedius that, rather than attaching into the base of the patella, they go off and they blend here onto the apex of the suprapatellar pouch. This muscle is known as articularis genu, and its function is to prevent impingement of the suprapatellar pouch. Okay, collectively, the quadriceps will produce extension of the knee. As discussed earlier, rectus femoris will also flex the hip, but functionally, we see the quadriceps becoming significantly active in anything that involves driving the body up away from the ground. So moving from sitting to standing. Eccentrically, they will work when moving from standing to sitting, on lifting the body upstairs. During walking and running, they're very important there. Kicking a ball, as I said, rectus femoris becomes very important in that situation. The vastus medialis, the lower fibres of vastus medialis in particular, that is sometimes called vastus medialis oblique, VMO, also has a role in preventing lateral excursion of the patella. All four quadriceps are supplied via the femoral nerve roots L2, 3 and 4. Here we can see a diagram of the patella itself. This is the patella, the quadriceps tendon, and the quadriceps converging into the patella. The patella is a sesamoid bone that, as mentioned earlier, increases the lever arm of the quadriceps itself. And it's a mobile structure. It is stabilized by the tendon of the quadriceps, so if there's any tension in the quadriceps at all, you won't be able to move the patella medially, laterally, superiorly or inferiorly. But it is then passively stabilized by other structures such as the medial retinaculum and the lower fibers of VMO, the lateral retinaculum and the anterior fibers of the iliotibial tract or of the iliotibial band. The balance of all of these structures is important for normal tracking of the patella. As the knee moves into flexion, the patella will slot into, the groove on the back of the patella will slot into the intercondylar area between the two condyles of the femur, which then stabilizes it further. Here on these movies we can see the patella sliding down as the knee is moved into flexion. This has a significant stabilizing effect on the patella itself. Okay, moving over to the medial compartment. Now, the medial compartment was covered when we looked at the hip joints, the muscles acting at the hip joint, because the medial compartment basically contains the adductors of the hip. So we've got adductor longus, adductor brevis, we can see adductor longus here, adductor brevis, adductor magnus, that all go from essentially the ischium and the pubis before attaching onto the length of the linea aspera. We've got gracilis over here on the medial side, the most superficial adductor. This is the only one of the adductors that comes down and crosses the knee joint before forming the pes anserine insertion, and therefore it contributes to movements of the knee joint. It contributes to the movements of knee flexion and medial rotation. And up here we've got obturator externis that acts as an adductor, and also anterior to that we've got pectineus. Now, the flexors of the knee joint are essentially the hamstring muscles. So around the back we've got biceps femoris, semitendinosus and semimembranosus. Gracilis will also flex the knee joint, as mentioned earlier, but so does sartorius. Although sartorius is found in the extensor compartment, it comes obliquely down and across the medial femoral condyle, the medial tibial condyle, before inserting onto the pes anserine attachment. Posteriorly, we've got popliteus and gastrocnemius that also contribute to the movement of knee flexion. And again, these muscles were looked at when looking at the hip joint. Gastrocnemius will be discussed in more detail when we look at plantar flexion of the ankle joint. Here is sartorius, as mentioned earlier. It sits in the anterior compartment of the knee joint, arising from the anterior suprailiac spine. It's a long strap-like muscle. It's a very, very long muscle. Has a very strange action because of this rather tortuous route that it takes before inserting into the pes anserine insertion. So at the hip, it will produce the movement of flexion, slight abduction, and slight external rotation, whilst at the knee, it produces knee flexion and medial rotation. So essentially the action of crossing your leg, so bringing your leg up onto the thigh on the other side. It's supplied via the femoral nerve, and it's important because it forms the lateral boundary of the femoral triangle. This is the posterior compartment, so we've got the three hamstring muscles, as mentioned earlier, that all converge onto the ischial tuberosity before passing down to their distal attachment. Two of them being medial and one being lateral. So over here we've got semitendinosus that lies on top of semimembranosus, and then we've got biceps femoris that comes down to the head of the fibula. The hamstring muscles are two joint muscles. They extend the hip joint and they flex the knee joint. Biceps femoris, because of its lateral position, acts as an external rotator of the flexed knee, and semimembranosus and semitendinosus are medial rotators of the flexed knee. They're functionally important, as what they do is they control knee extension during gait and running. When we look at the flexed knee, there are a group of muscles that will produce lateral rotation and muscles that produce medial rotation. The lateral rotator of the knee is only biceps femoris. Yeah, so with the flexed knee, biceps femoris will contract. It pulls the medial tibial condyle backwards and turns the toes outwards. So we get this lateral rotation. But medial rotation, there's a number of muscles that contribute to the movement of medial rotation. We've got the three pes anserine muscles over here: semitendinosus, gracilis, and sartorius. Semimembranosus assists with that medial rotation, and popliteus, that will be discussed in a moment, also contributes to medial rotation. When they contract, they pull the medial condyle of the tibia backwards. Popliteus in particular is important because it produces medial rotation not just of the flexed knee but also of the extended or semi-flexed knee during the unlocking movement of the knee joint itself. The knee joint is inherently an unstable structure that relies on ligaments predominantly for its stability. This provides static stability, but dynamic stability is provided by the surrounding muscles. So the quadriceps anteriorly, hamstrings posteriorly, gastrocnemius, popliteus, the adductors medially. Mediolateral and torsional stability is predominantly offered by the inert structures, by the collateral ligaments and by the ACL and PCL.